So this is a video on postural alleviation, scoliosis. Um, it's interesting that when you read the textbooks and you read about scoliosis and kyphosis and lordosis and these abnormal spinal curves, you tend to think of it as fairly black and white, but it's way more complex than that. The uh, You can't have a scoliosis without some sort of rotation elsewhere in the spine. It's usually called rotoscoliosis or something like that. And it will actually lead to some kyphosis and lordosis sort of changes. So these are all intimately related to one another. I actually like the term postural deviation more because it more accurately describes what's going on. Um, so So all of these really are overdeveloped curves or abnormal curves, as it were. So a hyperkyphosis is when you have a humpback. A hyperlordosis is a sway back. A scoliosis is some sort of a lateral curve. It could be an S shape. It could be a C shape, uh, convex left or convex right. Uh, it it kind of depends. And like I say, most of these things usually have some sort of a multiple sort of characteristic. It's pretty hard to have a scoliosis like in this figure and not have some sort of hyperlordosis in the lumbar spine. Um, it is fairly common to have this multiple things, and like I say, a lot of times they're called rotoscoliosis. Now, uh, most of them can either have kind of a functional problem, in which case what it is, it's soft tissue tension, it's muscular tension, it's holding elements tension that is creating this problem. Uh, and that is usually correctable. Ultimately, it's correctable. Or it could be a structural problem. The problem is that the bones, the shape of the bones, really maintain these curves. So if the vertebrae are wedge shaped, or the bodies of the vertebrae are higher on the left than on the right, you're going to have this kind of curve, and that could be from congenital factors. It could be from accidents. It could be from secondary to other diseases. Usually, when you have a functional problem, what happens is that the scoliosis is seen when the patient's standing upright, and it's noted at that point. But when you get the person to bend over, touch their toes, then that scoliosis goes away. And that is the sign that the scoliosis is in fact functional, and you should treat it, and fairly aggressively. Uh, if the scoliosis doesn't go away when they bend forward, then it's more likely structural. It may require X-ray or MRI investigation, and it's probably not um, something that we as conservative body therapists get to treat. Um, in your textbook on page 565, uh, it's saying that 80% of scoliosis are classified as idiopathic of unknown cause. Um, then there's osteopathic ones, some sort of spinal disease or an abnormality of the spine, or it could be myopathic, something to do with muscle weakness, or neuropathic, something to do with a disorder of the central nervous system. Things like muscular dystrophy would be myopathic, and things like paralysis or you know, polio would be neuropathic. Um, so it kind of behooves people to diagnosticians to figure that out, because the treatments are going to vary depending on what it is. There's no sense in trying to do a muscular sort of treatment for a, a neuropathic scoliosis. Um, One of the issues that people have with scoliosis is they're told they have scoliosis, and they think of that, they think of Quasimodo. They think of somebody with this horribly distorted spine that will end up in a wheelchair. And most people that have scoliosis have just some mild difficulties. But it can get fairly extreme. The scoliosis can get so severe that ribs can become impinged and breathing becomes difficult. That it actually can make the whole thoracic cage too small and impinge on lungs or heart. Can be problems like that. Kind of happens in 1 out of 100 teenagers. And it's about a 7-to-1 ratio girls to boys. Now, when I was in school, we talked about, is it that girls get diagnosed more than boys, or is it really that much of a difference? And it's probably someplace in between. One of the things about girls getting diagnosed is that most often the diagnosis happens when they're getting fitted for kind of their first nice custom-made dress. Maybe grade 8 graduation, or a wedding, that they're a flower girl, or something like that. And what happens is the dressmaker can't get the hem to sit right, and it's like, oh, I wonder what's going on. Oh my goodness, you have a scoliosis. And so, yeah. Like I say, most of them don't amount to anything. If it's less than a 30-degree curve, then we take a fairly conservative treatment. We don't worry all that much about it. We treat it with massage therapy, with chiropractic, exercise, maybe some bracing if it's getting more to 30-35%, to try and straighten that out. Once it gets past about 40-45%, then the person becomes a candidate for surgery. And what they end up doing is they end up putting in steel rods. They're called Harrington rods, and with little turn screws on it that straighten the spine out and straighten that curve out. It becomes a medical emergency or a medical necessity to do that because of the problems of breathing and impact on the heart. They don't do it so much for cosmetic reasons. Another problem with scoliosis could be just leg length differences, because leg length differences can cause the sacrum to tilt, the pelvis to tilt, which can cause that curve. Normally, what these people get is back pain. They get facet joint load differently one side than the other. They can end up with some osteoarthritis in the facet joints. They may end up with radiculopathies, which are the neurological issues. You diagnose it with by just by looking at it. They can do it with X-rays, in which case you measure angles running down to the apex of the curve, and that's one way. There's an instrument, figure 14.2 in your book has got an instrument called a scoliometer that looks at spinal deviation. It was actually invented by one of my professors. His name was Lyman Johnson, and he made a lot of money out of the scoliometer. And they're actually fairly expensive to buy, and it's not a tool that you use all that much. one of the things I find interesting is that there's now an app on iPhones that does it. Well, Lyman would have been either very happy or maybe very upset uh, that this is done now. Um, they treat these people often with electrotherapy, with massage, with manipulation, with exercise. I don't really see. I haven't seen very good results with exercise beyond just kind of pain management by uh, being stronger. Now the hyperkyphosis can be, we could often call it a dowager's hump. It happens because of compression fractures. It if it happens in young people, it's often in men, uh, and it creates this hunchback, as it were. Another common place that you're going to see it, and should spark you thinking if you see it, is that a lot of kind of middle-aged guys end up with this hyperkyphosis in the upper thoracic if they have ankylosing spondylitis, and it may or may not be diagnosed. So it's something to keep in the back of your mind. Hyperlordosis is a sway back. It's usually caused by muscle issues. Uh, could be postural issues. Oftentimes, overpronation in the feet can lead to a bit of a hyperlordosis. So, how it gets treated really depends on what's going on, what the etiology of it is, what kind of uh, severity it is. I mean, so treatments range from radical surgery, putting in steel rods, to just pay attention to it and learn to live with it, and everything in between. So most of what we end up doing for these people, especially if it's a functional or uh, uh, structural scoliosis, is just try to afford some measure of pain relief.